Ew.
Come in or?
Come on in. Nobody rules against it, so.
We probably shouldn't take a side into our opponents here. We should let them.
How's it going so far?
We've had one debate so far and it went well.
Okay. You get that? So,
Yeah. Oh, sure. There's Mr. Matthews or Mr. Fisk. You could just check.
did your mom make it to your first debate? She was trying to. Did your mom make it to your first debate? Oh,
I watched it like 10,000 times yesterday.
wow.
Leanne overanalyzes herself.
Isn't that uncomfortable? I hate watching myself speak.
I was like, 20 times. I'm sorry.
She said
You're getting inside your own head.
Am I supposed to flip the coin or does the timer flip the coin? That's my good question.
I won't tell. Whichever happens.
Let me rephrase this. Do I have to have?
Should be in the box.
Yeah.
There was
If not,
last time. We were in here last time. There it is. Oh, and one of them conveniently actually has a head on it.
Does he have a tail?
That looks like a tail. Kind of.
There's like
Pig's
somebody
tail.
bending everyone like this. Do you guys want to enjoy this one? Yeah, where do you?
Shams al-Balad. We went to the Citadel.
Okay.
And then
I still haven't been.
Yeah.
Where do you things?
I'll say, I went once and then also for Anzac Day, which was like Australian Veterans Day, and a dawn service there, and then I came to school.
Like in Dubai, they would always take people to the mall. That's kind of like Dubai's thing. And it has a giant aquarium.
Taj Mahal has a McDonald's. You're allowed to laugh. You're gonna notice it. Our demeanors are the complete opposite. She's sitting there like, and I'm just trying to laugh.
what does this compare to?
Is Koglar probably the opposite of Koglar and it's reflective. So I don't know what Koglar is, but something that's the opposite of Koglar but is reflexive. If I had told the joke, she wouldn't have laughed.
Pokemon comes out tomorrow, so it's a good day out.
They made a live action Sonic.
Yeah, it's really weird.
No. It
I
used
used
to look
to have
really
the
weird.
PlayStation.
Yeah, I
It used
heard
to
it
look
looks
really
better now.
It does. It looks so much better.
It's because they gave him calves.
No, they actually like made his face look like Sonic. Not some weird weasel coated creature.
I saw the article. I was like,
I know, on PlayStation.
how's it going?
Hi.
I miss you.
What's up? Hello, sir.
How's your name?
Simon.
So,
Monica.
Hi.
I miss you.
Hi. Thank you.
Hey, sorry.
Hi, I'm Maria.
I'm sorry to catch you. Yeah.
Nice to meet you.
Yeah.
Hi.
Which side?
Hello. Hello.
Oh,
We
our
were coin
coach-
toss, right?
Yeah, our coach prefers the lotus on the left. And the
Is this your
orange
last?
on the right. I don't know, so if you want to, you just for the same reference. So, you can pick the side like it doesn't change.
No, you want to see
Flip
that.
the coin. It's fine.
Short practice it. You're gonna start the.
Do you guys want to call it or should we?
You can call, we call it.
Okay, go ahead. Call it in the air.
Yes.
That's this. Well, it was almost good. Alright, you guys want, side,
We'll take pro.
pro?
Pro on the left
You guys have
side.
your first or second?
Yeah, we can go
We go
second.
Second, alright. Let's go ahead, we won't officially start the time until 2:30, so you have 2 minutes, and then you guys will have your 2 minutes prep time. So I'll keep the door
Should I
open.
time for minutes?
No, we'll wait till 2:30 to start. We're good.
So we get 2 minutes preparation time at the beginning of the debate and then not any time in between.
Correct.
Okay.
No, we have 2
We have
We
minutes
have
of
2
extra
minutes
time
throughout
in
the
the debate.
debate, so we cannot.
Oh,
have
so
30
we
seconds
can,
for
we can
now.
ask for like,
No, no,
30
Yes,
seconds. Okay,
yeah,
a minute,
yeah, sorry, yeah, 2 minutes per percent. John, let me just double check that. You're saying you use it at 2 minutes throughout?
Yeah, so like say, we want time
Like,
before the
like
second
if they
speech.
want time between rounds, they can ask like 30 seconds.
It's a minimum of 30 seconds and then in standard increments, so you can't ask for like 54 seconds.
Yeah, like, yeah. And the total for each side is 2.
2 minutes.
Yes, what's up?
that's it, that's all.
So proud of you. Running by service.
Yeah. Yeah.
And I just want to go ahead, get the clock ready. Jonathan, who is going? Sorry, you say you guys are going
Yeah,
first, right?
second.
Second, alright, so who's going first?
Leanne will be our first.
Excellent. Actually, you know, more wait till the call finishes. And then. So you keep the timer, so.
Yes, please.
Judges ready? Opponents ready? Partner? My partner and I are here to make the strongest affirmative case that NGOs are far more effective than governments at improving the lives of disadvantaged people. Some definitions for the argument are for disadvantaged, quote, unable to attain basic conditions and resources such as civil rights, shelter, adequate education, and medical care. Improve, as quote, to enhance in value or quality, make better. Both of those are provided by Merriam-Webster. And for specificity, revolving around the resolution, an NGO is a nonprofit organization that operates independently of any government, typically one of whose purpose is to address a social or political issue. Our points include NGOs providing healthcare and disaster relief with regard specifically to the 2010 Haiti earthquake and vaccinations in Africa and child marriage with evidence from South Asia. We believe that NGOs pick up the slack that governments leave behind as NGOs are more effective than governments. Contention 1, I want to make this on healthcare. Governments, particularly in Africa, where the disadvantaged people are in far greater need of assistance than those in first world countries, fail to provide healthcare effectively onto enough of the population. According to AIDMA International, there's only one doctor per 2,000 people in Nigeria, which has more doctors per person than most of its African neighbors, the exception being South Africa. Stanford is quoted as saying that fewer than 50% of Africans have access to modern healthcare facilities. This is where an NGO such as Doctors Without Borders comes in. Doctors Without Borders, who are active in over 70 countries, many of them being developing nations, provide for the basic healthcare needs for the people, which, as mentioned earlier, the governments cannot do. The Gates Foundation, famous for its work in vaccinations, does the majority of its work in distributions to the GAVI Alliance. Since 2000, the GAVI Alliance has vaccinated over 760 million children, preventing over an estimated 13 million deaths. My second contention is human rights, specifically child marriage, a practice common in poor and rural areas in South Asia. UNICEF reports that child marriage is in fact a violation of human rights. Quote, child marriage is a violation of human rights. It compromises the development of girls and boys. All these factors make it impossible to break the vicious circle of poverty, particularly for girls, says Osama Kogale, a UN representative. In 2013, the UN Human Rights Council stated that between 2011 and 2020, more than 140 million girls will be married off, oftentimes for financial reasons, before their 18th birthday. Over half of these child marriages occur in South Asia. Child marriage has been illegal in India since 1929, says National Geographic. Despite the fact that this law has been in place for a long time, the prevalence indicates the government is either unwilling or unable to stop the crisis. Again, this is where NGOs step in. In Pakistan, they successfully lobbied for the legal marriage age to be raised from 16 to 18 for girls, and despite the lack of available statistics, momentum towards ending child marriage is growing quickly. My third contention is disaster relief, for which I will be providing information from the infamous 2010 Haiti earthquake. Medium.com is quoted as saying that NGOs remain the main players in disaster relief around the globe. I stress, not governments. This is because NGOs provide more effective relief, they provide it faster and without hesitation, and can appeal to the global community for funding on demand, something a government with a fixed budget cannot do. According to worldvision.org, over 3 million people were affected by the earthquake in Haiti, as almost as many as a population of Amman. Half the affected population became internally displaced. There were 250,000 deaths and 300,000 injuries. CS Monitor reported that the government did nothing for 4 days. While they did nothing, NGOs sprung into action. In the 12 months following the natural disaster, Habitat for Humanity UK alone helped over 250,000 people with infrastructure, medical aid, and more. To conclude, I must affirm that indeed, NGOs are more effective than governments at providing aid to the most disadvantaged people through relief for unforeseen disasters, such as the Haiti earthquake, healthcare in Africa and rural Africa, and the defense of civil and human rights in the case of defending women's and children's right not to be married before their 18th birthday. Thank you.
Judge, ready? Opposition ready? Good afternoon, Honorable Judge. The affirmative would just like to begin by rebutting a few points made by the affirmative. The negative would like to rebut some points made by the affirmative. They gave 3 examples of NGOs being more effective than government. One was in healthcare, second in child marriage, and third in disaster relief and the Haiti earthquake. However, we failed to see where exactly government failed in the first example. Starting with the first example, they mentioned a statistic saying that in Nigeria there's 1 doctor to 2,000 people, but we don't have any evidence that this is subpar or it's a failure of government to provide access to healthcare to people. We simply have this statistic in a vacuum. They also mentioned 2 NGOs, Doctors Without Borders and Gates Foundation. They mentioned some statistic related to the Gates Foundation, but we got no evidence that Doctors Without Borders is we got no evidence as to what the impact of Doctors Without Borders was in Africa and how they improved the lives of disadvantaged people. We still have evidence to see for that. For the second example they gave of child marriage, we just heard NGOs. The only example they gave of NGOs improving the lives of disadvantaged people was lobbying governments to raise the age of marriage from 16 to 18. In this example, we would like to say that governments are the law enforcement and thus they are the reason why children are not allowed to marry at the age of 16 but 18, and NGOs simply lobby them to come to that decision. At the end of the day, governments are the organizations that make the lives of disadvantaged people better. And for the third example they gave of the Haiti earthquake, they said 250,000 deaths occurred in the first 4 days and the government did nothing. We would like to see some evidence behind this. We just see an unsubstantiated claim. We would also like to see the credentials of where this evidence came from. Now we would like to begin by introducing some of our own arguments to show how the greater scale of governmental operations far supersedes what NGOs are able to accomplish. We would do this throughout the debate by introducing 4 separate examples in different countries. First, we would like to talk about poverty alleviation in America through Social Security, a government program for the elderly. Second, we would introduce the National Healthcare Service, a public healthcare system in the United Kingdom, which improves the lives of disadvantaged people in that country. We would also like to introduce the example of Supplemental Nutrition Assistance Program in the United States, better known as food stamps, again, a poverty alleviating measure. And finally, the Pradhan Mantri Awas Yojana, a housing fraud program in India. We would first like to go to our first example of social security in the United States. According to AARP, American think tank related to social insurance, Social Security is a critical federal program that promotes income stability among millions of households in the United States. It does so by providing a steady stream of income to replace wages lost due to retirement, disability, or death. About 1 out of 6 Americans, 57 million people, receive Social Security benefits. For most of them, Social Security is the foundation of their economic security, and 22 million people of all ages. It is the lifeline that keeps them out of poverty. We not only have one piece of evidence supporting our claim that Social Security is extremely important in keeping millions of people out of poverty, but we have another piece of evidence from the National Academy of Social Insurance that says before Social Security in 1934, roughly 1/2 of seniors were estimated to be poor. Today, were it not for Social Security, the senior poverty rate would be 43.5%, and just over half of elderly African Americans and Latinos would be poor. We believe that these are solid examples of security has operated at a vast scale to alleviate poverty and improve the lives of disadvantaged people. In our next speech, we will also introduce the examples we gave earlier about the NHS, the Supplemental Nutrition Program, and the Housing for All program in India. But we would like to conclude this speech by saying that we would require solid evidence from the affirmative, since they have the burden of proof that NGOs are more effective than government, by providing solid evidence that governments have firstly failed, and secondly, NGOs have a better job. Thank you.
May we have 30 seconds?
Hi. You mentioned the social insurance program yet. What exactly did the government provide?
So Social Security is a poverty alleviation scheme enacted by government, and it has kept millions of people out of poverty since the date it was instituted in 1934. Our question would be, in the example you gave about child marriage and the effectiveness of NGOs in that case, you said that NGOs simply lobbied the government to increase the age for marriage. So how, in this case, how do you claim that NGOs were more effective than government, seeing the action was taken by governments?
Well, the question wouldn't have been even brought up if the NGOs hadn't stepped in. And so you mentioned that, so we're talking on balance here, but you mentioned that there were 56 million beneficiaries in one of your predictions.
Right.
So how would you say that proves that governments are more effective than NGOs?
We will come with more examples, but the single example we gave of 56 million beneficiaries is more beneficiaries than any example that you have given. So we don't see how that is insufficient to prove that on balance our case is correct. We will of course provide more examples to prove that on balance this is the case. You said that NGOs lobbied the government and said that the question would not even be brought up without these NGOs. Do you have any evidence to say that the governments were already considering this proposal, and if it were not for NGOs, this law would not have been enacted?
My partner will touch up on that.
Alright.
So, do you think it is the only reason that the poverty rates have been going down in the United States?
We have 3 pieces of evidence suggesting that the senior elderly poverty rate, that's citizens of the United States over the age of 65, would be way much more poor than they are today if it were not for this program. So we do firmly believe that it is due to this specific government program. In the example you gave about healthcare, you mentioned Doctors Without Borders, but didn't provide any statistics or evidence showing the impact of that NGO and the improvement of the lives of disadvantaged people. Do you have any evidence for that claim?
I do agree. My partner will touch up on that, but we do have evidence in that specific contention that the government's failed to do anything about this issue. So, would you like to ask another follow-up question?
Yes, so you say that you provided evidence that government failed in the area of healthcare, yet you simply gave one statistic saying that Nigeria had 1 doctor to 2,000 and said that all governments in Africa were thus insufficiently providing healthcare. Why would you say that that specific number proves your case and that number of doctors to patients is that does not improve the lives of disadvantaged people?
Oh, because if you look at the ratio from how many doctors there are to the population, then you would see that there's sort of this discrepancy. So I think that's one way that the government did not do anything about this issue. Provide sufficient healthcare for their people. Would you like to?
Yes. So you say 1 doctor to 2,000 patients is an insufficient number. Do you have? May I finish the question? Do you have any evidence saying that this is a subpar ratio of doctors to patients and that other countries perform better?
Could you clarify that?
You say that 1 doctor to 2,000 patients in Nigeria is evidence that governments do not provide healthcare to their people. Do you have any evidence saying that 1 doctor to 2,000 people is a bad number of doctors to patients, or is this simply a statistic in a vacuum with no comparison to other countries?
My partner will also.
All right. Yeah.
Judges ready? Good afternoon. For my second speech today, I will be reaffirming that NGOs are more effective in improving the lives of disadvantaged people by introducing several new points, as well as addressing concerns that were brought up by our opponents in the crossfire. So they have said that our statistics revolving around there being 1 doctor for 2,000 people, in Nigeria being a poor number, we have, and then also comparing it to the other countries in Africa, we have said that the only exception in the continent of Africa having more doctors per people is South Africa. We also have a quote from Stanford that says fewer than 50% of Africans have access to modern healthcare facilities. So we would say that this provides context and backs up our claim that governments are failing to provide healthcare, specifically in Africa. I would also like to bring up some points about poverty, specifically extreme poverty. The World Bank has defined extreme poverty to be, quote, living on less than US $1.9 per day. In 2015, some 10% of the world lived in extreme poverty. And while there has been a general decline, some regions are yet to experience a significant decline. A region in particular being sub-Saharan Africa, which was actually a region that showed an increase of the number of extreme poor. This is particularly important because the governments in these countries simply don't have enough money to be funding programs such as Social Security, which we see in developed countries in the United States. Because of this, and the fact that over 70% of the population in Burundi, the Democratic Republic of Congo, Malawi, and Madagascar, and other countries live on less than this $1.90 per day, we know that the government simply does not have enough funds to provide social security systems like this, proving that on balance, the government is not able to provide social security like this, and so NGOs are more effective because governments cannot do this, and so NGOs pick up the slack. Another contention, and this is directly related to poverty. In developed nations with financially sufficient governments, being poor and disadvantaged does not limit you in terms of education, as you are able to attend public school options in countries in Europe and in North America. However, the vast majority of people do not live in these developed countries, according to World Population Review for 2019. This means that they often have no free, quality education available and must pay money that they can't afford to send their children to school. I'll also add that it is due to poor education that women are put in a position where they have many children or are forced to be a child bride. And if they have many children, then they can't afford to educate them. It's a vicious cycle that, as I said earlier, can only be broken through outside intervention from NGOs. Some examples: it costs $350 for 1 year of elementary school in Malawi and other countries in Africa, $650 for a year of high school. Taking into account that the birth rate in Malawi is just over 4.5, we use 4 children in this example, it costs a minimum of $1,400 to send 4 children to school for 1 year. The GDP per capita in Malawi is $338. This proves that education is simply not feasible. NGOs such as World Vision allow for people to donate money and sponsor a child financially. As of 2017, World Vision has sponsored over 3 million children and operates in over 100 countries. Furthermore, every 60 seconds, World Vision reports that they provide a family with the means to alleviate poverty and give them all the advantages that they need. Further addressing some claims, some topics that were brought up in the discussion, our opponents brought up the fact that NGOs have been lobbying for the age of child marriage in South Asia to be increased, and they have, and this was effective. They also wondered what the correlation between the government actually acting upon this. We have evidence that says that in India, which has had a law for a long period of time, since 1929, the government is not enforcing this law. As of the over 1,500 convictions, only less than 300 people were actually sent to jail for child marriage. We see that this is the case because the government is not willing or able to punish the people that break these child marriage laws, specifically in poor and more rural regions where this problem is very present.
We have 30 seconds.
Time. To begin with, the con would like to state that the burden of proof falls onto the pro, and that the pro is supposed to prove that NGOs are more effective than governments. Simply giving statistics on the work that NGOs have done or solely giving examples of government failure does not show the comparison. The con would like to begin by rebutting some points given by the pro. To begin with, the pro spoke about child marriage, and they spoke about how NGOs campaign for this. But to begin with, the mandate falls on the governments to change laws. And they stated that the law was changed in Pakistan due to the lobbying of NGOs. But governments are, at the end of the day, the only ones that can change these laws. And the law changing from 16 to 18 is due to the government. Furthermore, the example provided by them of the Indian government not complying with the laws of child marriage do not prove that NGOs are more effective. They're simply remarking upon government failure, not giving us a comparison of what NGOs have done to eradicate this government failure. They also spoke about the Haiti earthquake, and they spoke about Habitat for Humanity providing 250,000 people homes, but they did not give us any comparison of any programs wherein the government has failed at them. They simply gave us a statistic of NGOs working and not of governments failing, which is what the pro is supposed to do, the burden of proof. They also gave us examples of extreme poverty in sub-Saharan Africa, and they gave us a statistic saying that the wage is 1.9 for extreme poverty, but they did not give us any examples of where the government has failed. They simply said that people are living in extreme poverty and that NGOs have helped them, but not how governments have specifically failed in this. They also did not give us any evidence in the education sector. They said that there is no free education in countries like Burundi, but they did not give us a specific source for this. They did not give us a source for how governments are not providing education. They simply said that the education system is poor, and they did not really further elaborate on this. After rebutting all these points, the con would further like to move on to our second example, wherein we will be talking about the Housing for All system in India. This also deals with extreme poverty and specifically shelter giving. So it was a scheme launched by the government of India which aimed to provide affordable housing to the urban poor.
Launched in 2015, the scheme proposes to build 20 million homes, including the economically weaker sections and the lower income groups. Throughout the year 2022, $29 billion of financial aid are to be provided by the central government. According to an article by the Economic Times, which is a reputable news source, the government has approved an investment of $6.4 billion for the construction of 68 million houses for the urban poor, including a central assistance committee of $1.5 billion by April 2016. A total of 8.8 million houses have already been approved against the initial demand of 11.2 million as of 29 August 2019. This already shows that the scheme has worked and that 8.8 million houses have already been provided to the poor. According to the Ministry of Housing and the Urban Affairs report in November 2019, the four components of this mission, which is slum redevelopment, affordable housing, loan giving, etc., have worked, and the Indian government has announced that they are further reducing the housing tax from 12% to 8% for this scheme for the urban poor. The second example of ours shows that the Indian government has successfully provided homes and alleviated the poverty in the nation. Our first example, Social Security, was also not attacked by the pro, and thus this example still stands to prove how the United States government has successfully alleviated poverty. And all these hard statistics that we have provided clearly show that governments are more effective. To end this, Econ would just like to say once again that the pro has a burden of proof, and simply giving us one side does not prove the argument that NGOs are more effective than governments. Thank you.
Are you guys taking time?
We have the grant. We have the process.
No.
We have process. Are you guys taking time?
No.
Are you sure?
Yeah.
Yeah.
Are you ready?
Yeah.
Okay. Sorry, when we do it, we send the podiums. I just didn't.
Oh.
That was just a miscommunication.
No, we usually, I don't know, we're used to just standing in our places, but I can come.
Yeah,
I
whatever you feel more comfortable.
Whichever user prefers.
So you said that $29 billion are to be provided. Can you prove that this money will be used effectively?
We have already given you a source by the Economic Times, which says that a total of 8.8 million houses have already been provided with this money, which shows that money is already being put into action. And by 2022, this entire scheme is to be completed.
They have built houses, but can you prove that?
Okay. What evidence do you have to show that the government has not put forth any initiatives in Africa? You simply stated that the number of doctors is 1 to 2,000, but you did not give any evidence of government failure.
So looking at the fact that Africa, predominantly sub-Saharan Africa and West Africa, is full of developing nations with low GDPs, the government doesn't have enough money to do anything. And so there is nothing to say for the governments. They can't do anything. So I want to re-ask this question because I don't believe you actually answered it. Can you prove that the money for the housing has been used effectively? You said that they have made 8.8 million houses. Can you prove that all of the money that has been provided to this cause has legitimately been used effectively?
Considering that this scheme is to be completed by 2022, we are simply providing statistics to show how the scheme has progressed. And clearly the money that is being put forth has been put to use, since 8.8 million houses have already been created and the total demand was 11.2 million. They are that close to the completion of their goal. You also mentioned that NGOs campaigned in Pakistan to increase the marriage age, but you did not give us any names of NGOs or how they went about this, etc.
So I have a source here. One such NGO was Girls Not Brides, which is a very big NGO when it comes to ending child marriage. You can read about them online if you want. They have an article, I believe, in the National Geographic that is Too Young to Wed. So you have said that they are reducing the housing tax. Can you prove definitively that reducing the housing tax brings people out of poverty?
We will further provide this analysis. Considering that NGOs do not really have the mandate to change laws in a country, how can the pro state that the child marriage age being increased is due to the NGOs and not the government that finally changed the law?
So the concept of lobbying is you have a group that has an idea that they bring to government. And the whole purpose of this lobby is to get the government to change their mind. Right? Without lobbying groups such as these NGOs like Girls Not Brides, the government would have had no reason to have brought this up in their parliament, and so action would not have been taken on this. Further, we see lobbyist groups in the United States. There's big examples of these, and they're very effective. The NRA is one such example. It's very effective.
I think we have 30 seconds. Yes.
They haven't proven national health care. They haven't proven that supplemental nutrition. And they haven't proven that social security on bonds works. They've said that it works in these developed countries, but in the real world, it's not developed countries.
Hi. Our contention is that affirming the resolution of on balance non-governmental organizations are more effective than governments at improving the lives of disadvantaged people have been healthcare, particularly in Africa, where the disadvantaged are in greater need of assistance. Efforts to restore human and civil rights in poor and rural areas by establishing social media campaigns, and finally, providing disaster relief, such as in the 2010 Haiti earthquake, where the government did not do anything for 4 consecutive days. While our opponents have brought up only the alleviation of poverty, our arguments have clashed on the topics of specifically education, and we have evidence that proves, well, we have a source specifically that proves, which is the World Population Review, and also our partners failed to provide any evidence for the social insurance, specifically what the government did exactly to help, and as well as the supplementing of nutrition. And we are talking about on balance here. So our opponents have provided evidence for first world countries, specifically in housing, yet they have failed to provide evidence for other countries. In short, due to our points of healthcare and making efforts to restore human and civil rights, as well as providing disaster relief, and how our case is the most valid and the resolution is true. NGOs are more effective than governments at improving the lives of disadvantaged people.
So quickly, opposition ready?
Yeah.
Judge, you are ready. Okay. Quickly answering a few questions brought up by the affirmative. They firstly said that we have not proved, the negative has not proved on balance that governments that NGOs are not more effective than governments. We're only giving examples from first world countries. However, a major example we gave was regarding India and the affordable housing scheme there. India is not a first world country; it's in fact a third world country, showing that governments also in third world countries such as India have the capacity to improve the lives of disadvantaged people. Reaffirming this example provided by my partner. They also said that they also got a question regarding social security and what exactly government has done. They have ran a welfare scheme since 1934, which dispenses benefits to the elderly senior citizens over the age of 65. It's a pension scheme essentially. They get checks every month from the government, keeping them out of poverty and therefore improving their lives. Otherwise, they would be disadvantaged. We would like to end our case by providing one last example of how governments are more effective, that how NGOs are not more effective than governments, by giving the example of healthcare in the United Kingdom. Before 1900, healthcare was mainly provided by charities and an unregulated private sector in the United Kingdom, according to an article by the British newspaper The Conversation. However, since then, after the institution of the NHS in 1948, people now live 13 years longer or have 20% longer life expectancies than they did before the creation of the NHS. And there are now 1.7 million people employed by the health service across the UK, making it the 5th largest employer in the world. That's 10 times the amount of people working in the healthcare sector at the institution of the NHS. This shows that charities and private NGOs were ineffective at providing healthcare to British citizens before the institution of the NHS. However, after the institution of the National Healthcare Service, we saw life expectancies rise and the lives of disadvantaged people, specifically poor people, improve who could not afford healthcare. We would like to end this speech by simply stating that the affirmative has the burden of proof to provide evidence that governments failed and that NGOs simply did not take action but took action when governments failed. And we believe they have not done so. However, as the negative, we have provided examples of NGOs failing and the governments succeeding instead. Thank you.
No, we're good. Can you prove definitively that the longer life expectancy in Britain is due to the UK health service as opposed to, say, the rising nutrition levels, as we've seen an increase in life expectancy throughout the world?
So we have an article by the BBC written by Nicholas Striggle, a health correspondent who has won awards for journalism. It's called The History of the NHS in Charts. This article cites a study which accounts for confounding variables, different variables, and attributes the increase in life expectancy solely to the NHS. It discounts other factors. That's why we believe that simply the institution of the NHS and this National Healthcare Service has directly improved the lives of disadvantaged people. Our question would be: you have said in a previous speech that we have not proved on balance the resolution because we have only given examples from first world countries. However, seeing that we have provided the example of affordable housing in India, which is a third world country, do you not see that this claim is unsubstantiated or untrue?
Yes, but the fact is the fact, and you have failed to provide any statistics for beneficiaries. You have only stated that there have been investments into housing. And what are the results of this?
I would also like to add that it's still unbalanced. So while India is a third world country, it is not most third world countries. We're not denying that governments can be effective. We are simply saying that on balance, NGOs are more effective. How do you respond to that question?
What was the question exactly?
Wait.
Could you rephrase it?
Yeah, could you please?
No, because we asked you questions.
Oh yeah,
and
no,
you
sorry.
answered.
So that was the answer.
Yeah.
My bad.
Yeah.
So you said that this study, which you did not name and you haven't provided that if it's credible or not, that was referenced in another study, discounts other factors. If it's discounting other factors, how can you be sure that it's entirely accurate?
I'll answer. He didn't say that it discounts other factors. He said it takes other factors into account and calculates that NHS was most effective. It doesn't discount other factors. It takes them into account. You mentioned that lobbying is when NGOs campaign to the government and work in partnership to change the laws. But considering that the pro is to prove that NGOs are more effective than governments, how can you give an example of lobbying wherein NGOs and governments work together? Don't you think that goes against the resolution?
The fact that the laws have been passed because of the NGOs, again, I said earlier, the law would not have been brought up if not for NGOs.
There wouldn't have been a need for NGOs if governments have been doing a sufficient job of providing for their citizens.
There are questions here.
Oh, I was just elaborating.
You can ask a question.
Okay, so in your response, you said that lobbying is an example of NGOs being more effective than government. But seeing in the case of lobbying groups, they're working in partnership with government and persuading government to institute certain laws. How do you say they're more effective? They're simply working in collaboration and with government, correct?
Again, because the NGOs are the ones who bring up the fact that the law needs to be changed. If not for the NGOs, the law would not have been changed. This is why NGOs are more effective. Without the NGOs, the law would not have been changed. We'll take the rest of our time.
That's a minute.
Yeah.
Okay.
Failed to decisively prove or name the study. And it's on balance.
Time.
In conclusion, my partner and I have decisively proven the resolution of on balance, NGOs are more effective than governments at improving the lives of disadvantaged people is true because of our contentions that our opponents have failed to negate around disaster relief, the medical care in Africa, and the fact that we have addressed their points revolving around India and the government programs there and the government programs in the United States, and they have also failed to name the study that proves that the healthcare system in Britain has been more effective. I'd like to point out the fact that I have a study by the Mises Institute that proves decisively that single-payer healthcare is the worst kind of healthcare. It states that when you have only one income of money for healthcare, the quality of the healthcare goes down. So yes, while the life expectancy in Britain may have increased, my partner and I do not see the correlation between having an ineffective system of healthcare and an increased life expectancy when there have been other factors such as increased nutrition. As stated before, our opponents have failed to address our points in disaster relief, and so this point stands. Our opponents have failed to correctly address our point revolving around medical care in Africa, and so we believe we have proven this point decisively. Anything else? And while they have stated that money and homes have been provided for the Indian population, they have stated that there was only one study that they used to prove how the American Social Security system has been effective, and so with only this one study and no other context, we believe that this point cannot stand if there's only one source and it's in the vacuum.
How much time is that study? We have 1 minute.
Okay, can you see?
Yes. Time. The con would like to begin by stating why we have been more effective than the pro in this debate. To begin with, we would like to contest their claims. The pro stated that we did not rebut their claim of disaster relief. When asked for proof that Habitat for Humanity had made an effect, they did not provide the evidence, though we had asked earlier on. They also simply stated that the government was inactive for 4 days. They did not give any example of how the government failed or did not later provide aid. Thus, we do not know if ultimately the aid that was provided was due to NGOs or governments. Thus, this disaster relief example does not stand. Furthermore, the child marriage example does not stand, as ultimately the mandate falls upon the government for the change of laws. And considering that the pro is meant to prove NGOs are better than governments, they cannot talk about partnerships such as lobbying, wherein the government simply takes an opinion into account, because at the end of the day, the government is the one that changed the law. Thus, this argument is not in their favor. They also spoke about vaccines in Africa, and when asked for evidence about Doctors Without Borders being proven effective, they did not provide us any evidence, though we had asked this earlier on in the crossfire. They also spoke about the Gates Foundation providing vaccines, but they did not give us any specific countries, the number of vaccines that they provided, or any such statistics. They also brought up a report, a study contesting our NHS claim, but they did not tell us whether this study was conducted specifically in Great Britain, which is where we are talking about. And they mentioned that we did not provide enough sources and simply one study, except we provided multiple sources. We provided the BBC, etc., for this specific case, proving that the NHS has been useful in the healthcare sector. We also gave 3 specific examples for social security, proving our case. And they said that we provided less examples, which we did not. And they have not successfully attacked these 2 claims, thus making them stand. As for our claim on the Housing for All scheme, we clearly said that this did make an effect, as almost 9 million homes have already been provided, and there are 3 years to go for the scheme to reach completion, thus showing how much has been achieved in a short span of time. On balance, we did give examples of first world countries and third world countries of governments being effective. And considering that the burden of proof falls on the pro, they did not give as much of a distinction between NGOs and governments as they should have, and simply provided one side of an argument, which goes against our resolution. Thank you.
Good job, guys. I wish I could shake your hand, but I was coughing in my hand. I don't want to get you sick. Yeah. Thank you.
Good job.
Well done.
Thank you.
How many more do you guys have today?
We
One more
have
debate.
3 more rounds. So one round, 2 rounds of type D and one more.
One more debate.
You guys are great.
Thank you.
Doing,
Sorry?
they had like the great strategy to take all their time at the end. And I swear that minute felt so much longer than a minute. I was sitting there like.
Good job, guys. See
Good
you.
job. See you.
Yeah, see you guys later.
See you.
Thank you.
See you. Sorry? That's the last one.
Yeah.
I'm pretty sure. Girl soccer. This weekend.
Leanne doesn't think that they did everything they said they did. Don't let that influence your decision. Also, are you judging any more debates? Because I have, like, on good faith, they probably didn't have their internet on, but maybe someone could check. 'Cause I know I didn't, but.
And governments have the power of it.
Um,
Their authority. That doesn't mean.
See you guys.
I'm just gonna take this next half an hour, so I guess good luck.
And good luck.
It's not that.
I have.
I'm gonna stab him with a pencil.
evidence.
John, go full John Wick on you. It's gonna make me very uncomfortable. I don't deal with emotions.
Oh, really?
I only like you. It's the only thing I do.
Jump into the door.
Oh, yeah.
Thanks. Yeah, no, come in. You're fine. When do you start?
Sorry,
When
when do
do
we
you
start? I think 3:45.
Okay, good. I'm just finishing. I'm just
Okay.
I'm Mr. Wood, by the way.
Hi. Nice to meet
What's
you.
your name?
Anjil Kaur.
Anjil. Anjil.
Anjil Kaur, like
Oh,
my surname,
Anjil.
because
Okay. Where are you guys in from?
from India, Mumbai.
Wonderful.
Have you been there before?
Last year was my first time. Yeah, we had a conference or a competition with MASB.
Oh, okay.
It was beautiful. Hello. I'm just finishing up.
I'm in 301, but I need some pencils from my own desk. What did you do? Oh, yeah, how was it?
It was good. It's tough, 'cause it's.
I do know.